class for like 6 months. So I wanted to know like what type of math
Well,
problem.
it's on the second page of your study guide.
Oh,
Um, oh no, we didn't list it out. So they're
mhm.
conversions. It's very simple math
Okay,
problems.
okay. I remember those.
Okay. Very simple conversion and then setting up formulas. I sent you in week one math resources.
You sure did, yes,
Yep.
ma'am.
So
Yes.
review that. Um, Pretty simple math problems.
Okay,
Okay.
yes, ma'am.
All right. Um, And then, as always with any exam, we're thinking about ad pi, right? The whole purpose of this class, community class, is to um, critical thinking, right?
Hmm.
Right from the knowledge that you have. Okay, you have to critically think to make clinical judgments.
Hmm.
Those are the two buzzwords with next gen, right? Critical thinking. So if you're presented a patient, that's what next gen is all about. If you're presented a patient or a client or a community, and here are the issues. You have to go through your ADPI. Okay, it's clinical judgment.
Hmm.
Okay. Um, um, what else was I going to say about that? So, yeah. So this course is about application, applying your knowledge. Okay, there's not a whole lot of new info. I mean, there's some new information, obviously, about the community, but you should have been introduced to most of these concepts in your previous classes. And like I've been saying for 3 weeks, now we're tying it all together and
Hmm.
applying it to making decisions of how we care for clients in our community. Okay.
Yes, ma'am.
So I'm just going through my study guide. I'm not going to pull it up here, but I'm just going through it. What's the difference between community-oriented nursing and community-based nursing? Shouldn't have to look at your paper now. We need to understand that. What is it?
Community oriented is I get them a little confused, but I'm just gonna shoot. I know community based, hello, they more focus on the illness
Mhm.
than
Just think
than
of
okay.
community-based. They're based in the community.
So it's I'm sorry, individuals. Yeah, because what made me um put this together about community oriented, and I don't mean to be racist, but I just think about the Oriental people as a big group. So the or community oriented is they focus on the group and they do prevention more instead of illness. Is that right or
Yep.
wrong?
Who's the group? The community.
Yes, ma'am. Community.
Yes. Oriented. Trent
Hmm.
just put something in the chat. Did you see what Trent said in the chat? He said oriented is more like viewing the community. Okay. Based is doing things. So think of based is you're based in the community. You're a home health
Okay.
nurse, you're a hospice nurse, you're a school nurse, you're an occupational nurse. You're based in the community. Okay. That's why on our quiz for this week, one of the questions was, or maybe it was last week,
It was last
which is
week.
a community-based nursing intervention? And it was the school nurse teaching the kid how to use his inhaler,
Yeah.
right? She's based in the
Hmm.
community. We're community oriented. You're, like you said, you're focused on looking at the whole population.
Hmm.
What is the health of the community? What are the risks? What prevention education can we do in the community? So oriented, just think big picture, based, you're based in the community.
Okay.
Does that help?
Yes, it does. Yes, ma'am. I just have to like think of it real slow.
Yeah, 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 yeah.
Yeah, but
But
I
I
was
think
like,
the word based is a good way to start the process. Based
mhm,
in the community, right? If you're based in the community, you already have a role in the community, you're taking care of individuals in the community.
mhm.
Okay.
Yes, ma'am.
Primary, secondary, tertiary. Remember P, prevention,
Hmm.
S, screening,
Hmm. And
T, treatment.
and they already have a disease
Mhm.
process and how to treat it.
So in that box, on your first page. We're giving you examples. Prevention of a problem before it even occurs, like teaching about bike safety, helmet safety,
Mhm.
teaching new parents how to position their babies to sleep, immunizations, seat belts for high schoolers, all about prevention. Okay. So, secondary screening, early identification, early intervention, right? It's early
Yes.
detection, right? Early detection, trying to prevent complications, attempting to stop it in its tracks and reverse it before it gets to tertiary, right? So, screening,
Yes.
mammograms, blood pressure checks, blood sugar checks, right? And then
Mm-hmm.
tertiary, management, management of the disease, treatment of the disease, reducing the symptoms, trying to improve the quality of life. Okay, maybe that's through medications, diet. Okay,
Mm-hmm.
so next section is vulnerable populations. Who are our vulnerable populations?
Have migrant workers, homeless, um, young pregnant adolescents,
Hmm.
substance abuse.
Who else? Yep, that's are veterans a vulnerable
Yes,
population?
yes, 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 ma'am. Better, yes,
How about pregnant women? Are they vulnerable?
yes. Um, Young adolescent pregnant women.
Teen pregnancy.
That's what, yeah, yeah, teen
Teen
pregnancy.
pregnancy is the vulnerable population. All women who are pregnant are not considered vulnerable, but teen
Mm-hmm.
pregnancy is. Gotta remember that. There's a difference. Um, Chronic STDs, HIV,
Mm-hmm.
hepatitis, and then those complex physical disabilities, right? The
Mm-hmm.
comorbidities, the dual diagnosis. Okay. Okay. Social determinants of health. I'm not going to go through this all page by page, but line by line, but you need to know how do we determine the health of an individual, a family, a community based on social determinants. Okay, that is in that first bullet under vulnerable populations. Very specific. Safe housing. This is right in your study guide. Safe housing, transportation, neighborhoods, violence education, job opportunities. So think of social determinants of things that are going on in the environment. Okay.
Mm-hmm.
You've got to think about those because those social determinants, let's say you live in a community with high poverty rate, high unemployment rate, high crime rate, low graduation rates. That's going to be a community that has issues, right?
Mm-hmm.
Okay. So know your social determinants. So highlight that word, social determinants. Okay. Next bullet, really important. I've been talking about this for 3 weeks. If you get asked about what are some primary causes of vulnerability, what's the biggest primary cause? Poverty, right? Have we talked for anybody in my Friday class? So you guys, we've already talked about this then, right? We've talked if we're in my Monday or Wednesday class, we've already talked about this. Poverty,
Mm-hmm.
primary cause of vulnerability. Okay, education plays a role in vulnerability. Okay. Higher levels of education lead to better choices,
Mm-hmm.
right? Outcomes, I'm just going down the study guide. Outcomes of vulnerability, right? Without any kind of intervention, you're going to have increased morbidity and mortality, right?
Yes.
What's the most important thing we need to consider with regards to interventions to vulnerable populations? It's at the bottom of page 1. Therapeutic communication. These people are already in a hole. Okay. They don't need judgmental, uncaring, incompassionate people. They need people to listen to them, tell their story, establish trust, right? We talked about that in class.
Mhm.
Okay. And then the two big words we need to understand for talking is important because they might not understand what's wrong with them. Exactly. They may not understand the severity of their disease or how their disease impacts their family or what the long-term health effects are of their disease. Okay.
Mhm.
Resiliency. Okay, please take a look at that first bullet on page 2. Recognize the role that resiliency plays. The more out of control they feel, the worse their decision making is going to be, right? How do you help these vulnerable populations become resilient? Okay. So typically the low resiliency is going to result in them not feeling confident to make, and they'll make decisions that actually probably make things worse. All right. They don't rely on us to increase their resiliency, but that's one of our roles. How do we lift them up out of the situation they're in if we can? Okay. And then the next bullet is caring. Don't forget about the caregivers, right? The care, whether they're
Mhm.
family, friends, neighbors, healthcare workers. You can't forget about caring for the caregivers of the chronically ill. Okay. They're at risk for issues as well. And that's what that bullet talks about. Okay, so please be familiar. If you guys, you don't need to memorize a study guide, but if you have a good understanding of each of the bullets on the study guide, you're going to do fine on the test. Don't overdo it. Okay, start here. Start here. And what you don't understand, go back to your resources, which is on the first page, all your readings and all that. Okay, but caring for the caregivers is important, right? The next couple of bullets are about homeless population, right? Creating a trusting environment, right? Obviously, trust is essential in establishing a therapeutic relationship, right? Um, Homelessness is correlated with poor outcomes. We know that. Okay, chronic high incidence of chronic illness. We talked all about this in class this week about the homeless population. We talked about them really in detail. Okay, so have a look at that. Vulnerability, I'm at the bottom of page 2. Vulnerability can be reversed by obtaining resources to increase resilience. Okay, the more we can strengthen these individuals' families, the more the resilient they're going to get. And the other word, I don't know if I have it in here, but we talked about motivation. Remember, we talked about that health fair, right? You're in the
Mhm.
rural community and you're having a health fair. Nobody really, I wouldn't say nobody cares about their health, but primary primary care, primary prevention isn't a focus of the rural population. You're the nurse out there in the rural population. How do you get them motivated to take an interest in their health care? And not just by bringing free food and, free transportation. How do you help them understand what's going on with their health? If you screen them and they have high blood pressure, how do you educate them on what the long-term risks of high pressure is? How do you get them the resources they need? So think motivation. Two things. Think motivation for any individual, but motivation, especially in the rural community. Okay. And then think resilience. How can you help individuals, families, communities that are maybe vulnerable or maybe going through a crisis or maybe have a bump in the road and they're trying to work through something with their kid, whatever. How do you help them increase their resiliency? Because the more confident they can feel about their current situation, the better decisions they're going to make and the better outcomes they'll have. In my opinion, so many people just lack resiliency. Sometimes it's just easy to give up, but we play an important role in that. They don't have to give up. Okay, that's our job as being out in the communities, getting them what they need to. And some may do it, some may not, but um, it's our job to try. Okay. Um, next section is school nurses. What do we know about, just read through this section on the school nurses. What do we know about school nurses? They are trying, what do school nurses do? Is a school nurse a community oriented role or a community based role?
Community base.
Right. They're
Yeah.
based in the community. They're working in the community. They're working with the kids in schools to teach them about whatever, how to give their inhaler, how to give their EpiPen. Right.
Yes.
We need to, be careful if you get a question about who, before kids show up in the clinic, who needs to be seen first? What are we thinking? What kid will we want to see first? Would we use our ABCs?
Yeah, so they airway would be first.
Right. Kids are having breathing problems. The kids who miss their medication can get in the back of the line, right? They'll get taken
Hmm.
care of, but um, so think clinical judgment. I mean, I was a school nurse for 20 years, and the amount of clinical judgment I had to make based on my knowledge was a lot. Okay, but you take your ABC, severe allergic reactions, absolutely. So if you get questions about prioritizing who needs to be seen first in a school nursing setting, think ABCs. Okay. We know that kids come to the clinic with chronic everything, stomach aches, headaches, whatever. But we need to be able to look beyond that. For example, if it's not just a one-off and you've got a student coming in with bellyache or a headache at the same time every day, and it's going on for 2 weeks, and you've talked to the parents, what kinds of things we're required to look beyond that? What kinds of
Hmm.
things might we be looking for?
Possible child abuse, maybe.
Right? Child abuse.
Could be
Um,
bullying.
how about bullying,
Hmm.
harassment, right? Might end up being a mental health issue. But thank you, Trent. My point is that if they come into the clinic and something's not up, or something's up, other than a headache, because let's say they've been coming between fourth and fifth period every day for a week. Finally, you just need to dig deeper, and it's okay to dig deeper. What's going on? Okay. And usually that extra question of what's going on will kind of open the floodgates of what's going on. Okay. So the point is you have to be able to look deeper.
Hmm.
If you feel like something's wrong, something probably is wrong. Okay. Um, Obesity in children, there's a whole bullet about that, right? We know obesity in children causes short-term and long-term problems, right? How do we work with parents? How do we work with the kids? How do we try and reduce that or reverse that? Um, Unemployment and depression in a family place. Unemployment and depression in a family place that family at risk, right? Though not only are the parents at risk, but the kids are at risk,
Hmm.
right? So school nurses, we have to be very aware of family situations as well. And you can call parents, you can talk to counselors. What have they heard? What do they know? Okay, I mean, look what's happened over the last couple of years with the pandemic.
Hmm.
Think of all the mental health issues going on with these kids, whether it was isolation or depression or lack of education. A lot of these kids are struggling. So, um, and then one of the other things school nurses, we deal with is different cultures. Okay. We have to be able to develop relationships with all the parents of different cultures. It may take an interpreter. It may take, um, this is all about cultural competence, cultural sensitivity, right? Because you're going to have all different kinds of cultures in your schools if you're a school nurse. And then at the bottom of page 2 is the adolescent student. We know that adolescent students who have begun dating, okay, they're at very high risk for violence. Okay. So how do we talk to that adolescent student? Maybe we ask them open-ended questions, you know, not, oh, do your parents approve of your relationship? Or do your friends approve? Maybe just ask them how it's going.
Hmm.
Yeah. Just ask them how it's going. Ask them those open-ended questions. How's it going? See what they say. All right. Because we know in the back of our minds that adolescent dating comes with violence. It comes with domestic violence. Sometimes these kids are too young to recognize those symptoms.
Hmm.
So it's important to be able to talk to these young kids about dating. And again, not judgmental questions, how don't you, is he too old for you or is she too young for you? Simply, how's it going? How are things going? What does your relationship look like? And after that, you then start to assess the answers of are there red flags or not, right?
Hmm.
Next section is educating parents about maintaining their infant child's health and safety. What should they know? Okay. I always repeat that first bullet. The greatest impact on a child's overall health is the financial status of the family. We talk about this talk about this every week. Okay. The financial stability of the family determines everything, right? So
Hmm.
if the family's not financially stable, maybe there's going to be food insecurities, education, healthcare, transportation. It comes with everything. Okay. And then there's some information about educating new parents about safety guidelines, regular checkups, caring for the immunocompromised child. How do you do a home safety evaluation? So you're going in and doing a home visit. What's the first question you ask? This is right on your study guide. First question you ask. Didn't we talk about this in class? Do you have firearms? Right? First question you ask, do you have firearms? The answer is no. Okay, move on. The answer is yes. What's your next question?
Or
Right, your study.
you have them stored, put away.
Show me where they are stored and put away. Show me. Not are they? What if they say, yeah, and they're not? Show me where they're stored is the question. All right. The priority for the nurse, I'm reading right from the study guide. Priority for the nurse is to find out where the firearm is stored. And they should be stored unloaded, locked, and the ammunition should be in a different place. Yep, Trent, how they are stored, are they locked up? Are the kids able to reach them? That's why you want to see where they're stored and locked up. Yeah, it sounds intrusive. One of my first my first terms here, um, when we were going through this, I had a student who was a firearms instructor, right? Big, 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 pro gun student. And she told the class, if you came into my house and asked me that question, I wouldn't show you where anything was. I'm a firearms instructor. I don't need to show you where. I was like, okay, for purposes of this class, could we just get back to the class? But she was hot about that. Nobody's going to know well, you know what? As a home health or visiting nurse, you do need to think about your own personal safety as well. What about if you're going into a troubled neighborhood that has a lot of violence, a lot of gangs? I
Yeah.
mean, there are sick people in those neighborhoods too that need to get cared for.
Well, I mean, I care. I'm a Southern woman. I care guns. Everywhere I go, I have my piece on me. That's just how I was raised. Yes, ma'am. I'm a firm believer. Carrying a gun. I am.
Mhm. Trent, I like what you just said. Hang on, let me get back to the chat. It popped out. People are curious. You never know what they're going to find on accident. Absolutely. I mean, one of the big things we talk about, and I think we've already covered it in this class, is doing your home visits and the crucial importance of personal safety, right? And this is a crazy world right now, right? So, um, anyway, I was telling that story about that first student. I'm not showing anybody where anything is. None of your business. Okay, the next section you guys can go through, as I told you, it's your common childhood ailments. Okay. I have narrowed the information down in this section to, like I said, 5 or 6 bullets for each one. That's what I'd like for you to know. Okay. So this is not a section where if you don't understand it, go back to your notes. Don't go back to your notes. Your notes are very detailed about each of these ailments. Okay. I want you to focus on these particular bullets for each one. And you know about these you know about these common ailments from your previous classes and from your discussion question. Okay. So I'm going to skip through that since you guys can read through that. And then lastly, which is this past week, let's talk about rural populations, migrant farm workers. Well, migrant farm workers are part of the rural population. So they have a lot of the same issues going on. What do we know? What did you guys learn this week in class about rural populations? Are they focused on primary care, on health prevention? No,
Mm-hmm.
right? No, that they're not thinking that. And so this first bullet on rural populations really does speak to that motivation. Okay. Rural population is much less focused on health promotion. The community nurse has to work with this population. You need to understand strategies to motivate this population to take advantage. Exactly, Trent. They may not even that's my point. They may not even know they need to focus on it. So what I have, high blood pressure. It wasn't that high, or um yeah. So one of the most important things I think, to motivate your rural population is truly having them understand the impacts of health on them, both short term and long term. Okay. And then the second bullet talks about motivation. To understand motivation, you need to, number one, how people involved feel about their health problem. Yeah. Yeah. How do they feel about it? Do they think it's serious? Right? Do they think, oh, okay, I'll drive down to the cities and go to the doctor or whatever, cardiologist? Do they think that's going to make a difference? If they think it's not going to make a difference, they're not going to go. So it's up to us to educate. Okay. And then whether they think they can both manage the barriers and actually go through with going to the cities and going to the doctor. So there's four learning points in your study guide about understanding motivation. Right. Do they even have a point of reference of how serious their condition is? Let's say nobody around them ever had high blood pressure, nobody around them ever had diabetes, nobody around them ever had cancer. What's their point of reference? They don't have one.
Mm-hmm.
Oh, I'll be fine. It's going to be good. Everything's fine. Okay. Then there's another bullet about motivation. Okay. We know that in the rural communities, there's definitely more, excuse me.
That's true.
Thank you. Depression, substance abuse, domestic violence, child abuse. This population's at much higher risk for all of those. Okay. We talked about anonymity. Why do members of the rural population, why do they hesitate to seek care? They don't want everybody knowing their business. Everybody knows everybody. So since child abuse is more at risk, domestic abuse is more at risk, a lot of times we don't see these families till they show up in the ER, the urgent care, right? They're in crisis, or their disease is more conditions more in an advanced, more in a advanced stage. Okay. They like their and they want things private. That doesn't happen in a rural community. Okay. So that's another big issue, is their unwillingness to come forward early. Not to mention the mental health issues may be a point of shame. Exactly, based on how they grew up. I don't know about you, but who didn't have a family down the street growing up? Oh, that's just the Joneses. Don't worry about them. They're always yelling at each other and they're always doing this and they're always doing that. Right? You tend to, it just becomes accepted. Right? So a lot of mental health issues, a lot of substance abuse issues, a lot of guilt, a lot of shame, a lot of potential legal issues if we're talking abuse and child abuse. And, rural populations also have undocumented workers. So they don't want to come forward either for fear of their immigration status will be questioned. So, anyway, there's a whole section on rural populations. And then the last section is the migrant workers. We talked about the migrant workers at length. Them trying to access healthcare. Do they qualify? They're always moving around. How do we try and keep a continuity of care with them? If they're always moving around. They're kids on the farms, parents on the farms, so many exposures, so many barriers for them, right? Perhaps they don't even have a health history because of just being migrant. Perhaps they've never seen a doctor. Perhaps they don't even know what's going on. So when they feel ill and maybe somebody suggests they go to the doctor, they may or may not, based on all their fears. So rough. It's tough being a community nurse out in the rural population, out in the rural communities, taking care of rural populations and then migrant populations within that rural community. So that's your study guide. Couple things. Anybody have any questions about content? I want to go over some test taking strategies. What are some of the test taking strategies that you guys use that might be helpful to your peers? What do you guys do? What do you guys do to help prepare for a test?
I pray.
Okay.
And talk to God. And ask him to bring everything that I studied for back to my remembrance, and I can just apply it to my exam.
Mm-hmm.
I do.
I love it, Trent. Love it.
Mm-hmm.
So, a couple things. Try and be confident going into your exam. If you feel like you're prepared adequately, go in with the attitude of you got this. Okay, I got this. Okay, exams are always stressful. I understand that. But if you have done your due diligence and prepared for your exam, studied the study guide, you're going to be fine. Okay, don't spend too much time on a question. Okay, read it a couple of times. If you don't get it, and you'll know you don't get it, just pick an answer, take an educated guess, and move on. Don't sit on a question and read it. Yeah. Trent has another one. If you see something that you have no idea how to answer, pick apart the language. Right. Try and understand a few words in the sentence that may lead you to an answer. If you don't understand the full scope of the question, read it a few times and move on. Pick an answer, move on. Don't get stuck. Okay. If you get stuck, your confidence is going to, be swayed. It's one question. Pick an answer and move on. Okay. Do I have any students here that change their answers? I'm a don't change your answer. In order for you to change your answer, you have to be able to convince yourself of why you're changing your answer pretty concretely. Okay? Not unless you're 100% certain, right? If you, oh, I think I heard her say that in the review. I think I heard her say that in class. I think I remember seeing that in the book. That's not justification. If you're uncertain, do not change your answer. You need to be able to be 100% confident that you picked the wrong answer.
Mhm.
So if you're an answer changer, it's a bad habit. Okay.
The first well, my what I do is the first thing, the answer that pops up in my head, that's the right answer. If I
Hmm.
go back and change, I've always done it. I go back and change, and it was wrong, and that
Hmm.
was the first answer was right.
Hmm. Okay. Well, learn from experience then.
Hmm.
The other thing too is, yeah, I'm going to talk about the negative questions in just a minute. After you read a question, maybe try and, I don't know if you can put a piece of paper up in the, well, probably not that, but look away, look up, look down, look wherever. See if you see if you can come up with an answer in your head. What would be the right answer, right? Come up with it by yourself first, and then go back to the answers and see if there's something close to that, or see if that's a choice. Then you know you have the right answer. But think about try not look at the answers first. That's another strategy. Another student told me a couple terms ago that she uses the highlighter on the right side of the your question. And so when she reads a question, she highlights a word, right? She highlights priority or first or initial or last or whatever. Or if there's a phrase in there that indicates it might be a negative question, she highlights that. She highlighted that. So that when she goes back to read it a second time, that's where she focuses. That was a great idea. So let's take a scenario and let's do a positive question and a negative question. Okay. You are one of your scheduled visits today is you're going into a home. Um, oh, Trent uses the highlighter. Really helpful, can give you the key aspects of the question and started doing better on exams. Well, there you go. So think about the highlighter. All right, you're going into a home today, and it is a smoking home. Okay, and the kids have asthma. Okay, and your job today is to teach the parent about the effects of smoking on kids, especially with asthma. Okay, the positive question is, um, what does the parent state to you that gives you the confidence that she has understood what you said, right? That's a positive. What do you want the mother to say that makes you think like she learned, like, I get that smoking is harmful to my children. I'm now smoking outside. Not
Hmm.
great, but it's okay. Okay.
Or she won't smoke in the car with the kids in there.
She won't smoke with the car and the kids. Asthma makes secondhand smoke makes asthma worse. So what does she say that you say, okay, she got it. She got it. Okay. Negative. Let's use the same scenario and ask a negative question. After you're done your teaching, what does the parent state to you that you now realize she needs more education? So the parent says, "Oh, don't worry about it. I can smoke wherever I want. I vape now.
Yeah, I vape.
I vape." Or, you know what? Don't worry about it. I used to smoke 2 packs of cigarettes a day. I smoke one. Okay. She didn't get it.
Mm-mm.
Okay. So that's a difference between a positive and a negative. Okay. Positive are good things, negative are bad things. Okay. So what did she say that concerns you that she didn't hear a word you said? That's a negative question. You're looking for something negative. Does that make sense?
Yes.
Be careful on those questions. Okay. If it's asking it in the negative way, you're looking for a wrong answer. something somebody said that's wrong. In the RN, we have an exam question that's about your like they need further teaching, right? They need further education. We have, I think there's a question about you're mentoring a new student and new nurse, and she's working with the family. The patient had a stroke. She's working with the family on discharge teaching. Okay. Um, Positive. What what statement does she make to the patient that she understands the correct teaching for stroke patients upon discharge? Okay. So maybe it is the home health nurse will come in when you get home and do a safety assessment of your home. Okay, perfect. The negative would be she says something that you know is incorrect that will require you to do further education with that new nurse so she doesn't say that again. Right? Yeah, passing personal judgment. Exactly. Okay. Um, I'm looking. You guys are attending live review sessions, so that's great. And then you have the other two recordings of Ford and Kershaw. You're obviously preparing for the exam because you're here. Um, don't forget those key words. If you get to a question, all the answers look correct and you're only selecting one, you miss something in the question. Okay, so um, what so if you were asked a question, what would be the priority teaching point for families with parents with asthma or kids with asthma? What's the priority teaching point? Let's say all the answers looked okay, but inhaler was the priority. Does that make sense? Let me step back. You go to look at all the answers. Everything says, oh, this could be the answer. This could be the answer too. That's a good idea. You miss something. Go back to the question. It's probably going to say, what is the first thing you do? What is the last thing you do? What's the initial thing you do? What's the priority? Okay, so if you get to a question and all the answers look correct and there's only one correct answer, then go back and reread the question. Mm-hmm. Yep. So be careful of those words and phrases in the question that will indicate whether it's a priority question. Okay. Um, you got lots of practice questions to do, right? In your student resources as far as practicing how to take NCLEX questions, right? I think those are the big ones that I have. Does anybody want to add to that? Know your terminology. Okay. If you don't understand the terminology, go back to your readings and look at the definition of the word. Okay. If your readings came from a chapter in the book, they have a whole list of key terms at the beginning of every chapter. Okay. I mean, the fact that you guys are here is great. Oh, that's a good idea. Trent says when he doesn't know the vocabulary, he makes a kahoot game for the words he has trouble with. It's a great idea. So, so that's what I have. Is this helpful
Yes, ma'am.
to go through it like this?
Mhm.
Just just don't overdo it. Stick to what we did in the last 3 weeks. Okay, don't feel like you have to. Like I said, if you have a good understanding of the study guide, you're going to do great. Okay. Um, I had to restart the recording, so would you guys put your names and your professors back in the, you guys don't have to put me in there, but Emily. Ooh, did I say that right?
Yes, Emily.
Emily. Okay. Oh, Emily. Oh, Emily M.
I'm gonna put my name on the chat.
Yeah, thanks. And your professor. That'd be great. Trent, I just missed your last. You had something to say before that. Hang on. What did you say? I like the discussion. It helps put these concepts into the open and helps me visualize it. Right. Well, this entire course is about visualizing yourself out in the community, not in a hospital setting with housekeeping and food service and uh, all the support staff you have in a clinical setting. This is out in the community. You're now doing that. You're doing that in people's homes, right? You're assessing environmental risks, safety risks, food risks, families, doing family assessments. How do they communicate? Do they get along? Or is it a very, um, unsettled house? Now, what's a functional family versus a dysfunctional family? So, do you guys have any questions?
Don't.
Thanks for coming. I appreciate it. Um, I'll get this recording out to everybody as soon as actually I have to teach a class after this. So once I finish teaching the class, I'll get the recording out. Okay. I hope this has been helpful to kind of talk
Yeah,
through it.
yeah, because I listened to the first two professors, and then I listened. Well, I'm in your class, and then um I listened to yours as well and participated.
Yeah, great. I'm glad you're all here. All right. Well, you guys have a good, it's Friday. Have a good
Mhm.
weekend. You guys, at least my students, you know where to reach me if you get stuck before your exam and there's a few things or there's some concepts that you don't understand and you want to go over, reach out to me. We'll schedule a quick Zoom. We'll go through it. Okay?
Right.
All right. Have a good day.
All right. See you in a minute, Mr.
You
Professor.
too.
All right.
Okay. Bye.
Thank you.
Okay.
Thank you.
Bye-bye.